Stellenbosch University, the University of the Free State, and the University of Cape Town are making COVID-19 vaccinations mandatory for campus access. These policies are igniting debate over whether businesses and institutions, including schools, can make vaccines a condition for entry. For more on this particular aspect of the debate, we're joined by University's South Africa Director of Operations and Sector Support, Dr. Meyer, and the South African Union of Students spokesperson, Asive Dlanjwa. Good evening to both of you, and thank you so much for your time. Perhaps let me begin with the universities and hear what is really informing this move to implement these vaccine mandates. Dr. Meyer, where is this decision coming from?
So for the universities that have taken this route where they want mandatory vaccination, and we must qualify that, it's mandatory to be vaccinated to access their premises or their sites. Their right is really entrenched in obviously, as we know, the property rights of the Constitution and the Higher Education Act. So they do have the rights to set these limits. But obviously, we as University South Africa are urging all stakeholders to work together, and that this is an effort of educating, advocacy, and to make sure that people get vaccinated and know the positive benefits of being vaccinated.
So it's mandatory for the access of the premises, which means that it does not just apply to students, it applies to anybody who would want to access these institutions. What does it mean for the students or even the staff who may not want to get vaccinated? Will they be able to do their jobs remotely, work remotely?
So the issue, one of the key issues obviously that are driving the university's debates is the Occupational Health and Safety Act that makes it compulsory for employers to make sure that their workers are safe. And there's an additional requirement that says that if workplaces that work with the public don't make sure that the workplaces are safe and that adequate mechanisms are taken, it's in fact a criminal offense. So what the universities are saying, these particular universities, is that they will limit access to their residences, to public spaces, to curb the spread of the COVID-19 virus.
Look, it's very much probably not the end of this debate, because it doesn't just apply to universities. I think different sectors in the country are going to go through it. In fact, it was Business Unity South Africa just earlier this week that said it was going to be heading to the courts to seek a declaratory order on the issue of vaccine mandates. Asive, let me bring you in here and perhaps get the view of you as a student organizers, as a formation of student unions. Where do you stand with this issue? If the universities are saying, well, we have an obligation by law to make sure that our premises are safe, if we don't abide by the law, then we'll find ourselves in hot water.
Thank you, Kathy. I think I must start off by saying that we encourage all students, absolutely in all institutions of higher learning, to go and vaccinate in their numbers, and if possible, all of them. But what we do not agree with, Kathy, is that students and workers must be vaccinated against their will and against their constitutional right to self-determine whether they want to be vaccinated or not. The issue of law and the Safety and Occupational Act, we think it's just scapegoating, because if indeed there was no other avenue and the only way to get people vaccinated was through the measures and forcing and coercing workers and students to vaccinate, then we are
Asive, we seem to be losing part of your connection there. I'm not sure what's happening, but perhaps if you can also maybe try moving, not too much, just a little bit, so that we're able to get a better connection to you. We lost you at the part where you were saying that the issue of the Occupational Health and Safety Act, that is just scapegoating on the part of the universities.
Yes, the network is a little bit unstable. But as I was saying, was that we are of the view that the use of the Occupational Safety Act is a mere scapegoating by institutions of higher learning to coerce workers and to students to vaccinate against their will. We are saying if coercing and making the vaccines mandatory for all, for people, that is the only avenue that is available, why hasn't government also exercised the same agency? Why is it only institutions of higher learning that have gone to that extent? when other societies also are supposed to be vaccinating. So hence we are saying we believe that institutions of higher learning are merely scapegoating by using the Occupational and Safety Act to make workers vaccinate.
Asive, of course, it's not just the universities that we have seen go in this direction. We already have a number of private sector companies that have given their workers deadlines to be vaccinated, some by early next year. So, and right now, you would have seen the game that was held recently at FNB Stadium. The people that were allowed to go in were those who could produce vaccine certificates. So by all indications, there are different sectors of this country that are moving in that direction. So do you see a difference necessarily between a restaurateur saying, well, you can only access my premises if you have a vaccine certificate versus when a university does it?
There's a huge difference, Kathy. One of them is that, firstly, we are speaking about issues of leisure. To go and watch a soccer match in FNB is a leisure issue. To go to the restaurant is a leisure issue. But access to work and access to education is a basic human right that everyone must be afforded. And therefore, the issue of the vaccine cannot be used to deprive them of that particular right. So it is not the same thing. In fact, we support incentivizing and creating incentives for people to vaccinate, be it the fact that they can watch soccer at the stadium, attend certain concerts, etc., etc. We are fine and we welcome that. But what we do not want is that the rights, the basic human rights of citizens be impeded upon. And the question that still remains, chief amongst all, is that if indeed this is the only way, and that is to coerce citizens, why has government's message been that of encouragement? But there are certain sectors that want to coerce people against that which government is currently doing. So this is why, and also you see in institutions of higher learning, it becomes particularly challenging and particularly troublesome, because we appreciate that institutions of higher learning are spaces of debate and are spaces where we should be persuading each other through facts and science. Therefore, how do you in an institution of higher learning start by coercing students? Why have universities satisfied themselves in that they have been able to adequately and sufficiently engage intellectually with their workers and with their students before resorting to such measures? This indicates to...
So, Asive, what are you saying? Are you saying ultimately that part of the reason that students are rejecting this is because you are not necessarily convinced by the science that universities are using to justify this decision?
We are convinced by the science, Kathy. It is particularly why we are against mandatory vaccinations, because we are saying the science itself is sufficient to convince people, engage them scientifically, show them the benefits. About a week ago, we had an engagement with Higher Health, and Higher Health was able to produce and present, make a full presentation, scientific presentation on why we need to vaccinate. And everyone who was there, even those that were doubting the need to vaccinate, left there, 100% of them, convinced of the fact that vaccination is the way to go. So it is particularly based on our belief in science and the scientific arguments that have been made by scientists and medical practitioners that we believe that do not coerce people, show them the science, do not be lazy. You are an institution of higher learning. So you have how are we going to go to society and convince society when we cannot convince people in institutions of higher learning? You are undermining the science itself. And by the way, another point, Kathy, when you create this when you take these draconian approaches to dealing with critical matters like this, the only thing that you will get is more resistance, because people are saying, if this thing is so good for us, why are we being coerced into doing it? So it is in fact... Yeah.
I'm going to pause you there. I want to give Dr. Meyer an opportunity to respond to part of what you've said. So, Dr. Meyer, you've been listening in to what the leader, one of the leaders of the South African Union of Students has to say. Do you take the points that he's making? Are these things that you have heard before from the perspective of the universities?
I think we must be mindful that the vast majority of universities are taking the consultative route, and they do want to convince people to be vaccinated. And when we speak about the universities with their councils, and we must remember that on the councils, the student representatives are represented there. So we can't interfere, with what they refer to as institutional autonomy. However, as I've said, as USAF, we are encouraging stakeholders to work together, advocacy campaigns, convince people. The science is sound. And the colleague from South has reiterated, they're not against the vaccination, but it's about how we go about convincing people to get vaccinated for the greater good, for the greater social compact that ensures that everybody is safe on campus.
Is there a particular posture that, as University South Africa, you are taking when it comes to advising your members on how to engage with students on this issue? Are you encouraging them to be consultative, or are you saying, look, do whatever you want to do, just come back to us with the result?
No, our stance is that we do want parties to be consultative. Nothing that is forced is ever openly accepted. We understand that. But we understand institutional autonomy, but our formal position is that we must work together as stakeholders. It's very difficult when you force people to do something to accept it. And we really do want the science behind this, that we have active campaigns, that we have more vaccination sites on campuses, and that we work closely with Higher Health and the departments and our colleagues at SAUS to ensure that everyone is well informed about what the processes are.
Of course, we're at a time where the academic year will be wrapping up soon, but the issue of vaccine mandates is really going to come to a head at the beginning of the new school term, especially if the restrictions in the country are especially if the country is as open as it is right now.
Absolutely. And I think that if we don't reach a medium for institutions that have gone this route, we understand that it's going to be difficult. Students might protest, they might not accept the decision, and we're mindful of that. But, in the greater good of University South Africa, we've said, everyone, please vaccinate, please set up the sites, and let's work together collaboratively so that we can address this issue.
Do you think that this matter might end up in court even for universities?
I think for universities and the broader society, I anticipate that it will, because people are feeling that although no right is absolute, that their right to bodily integrity and religious freedom might be impeded, and they might test these cases, and it's not incomprehensible that indeed will happen.
All right, so this story is certainly far from over, and like I said earlier, we had Business Unity South Africa saying it's going to be approaching the court for a declaratory order on the issue of vaccine mandates, so that it's clear from a legislation point of view where the law stands when it comes to organizations, institutions enforcing some of these vaccine mandates. A conversation that's far from over. That was the Director of Operations and Sector Support at the University South Africa, Dr. Linda Meyer, and spokesperson of the South African Union of Students, Asive Dlanjwa.